Good morning, good afternoon, and good evening, everyone. My name is Tung, and I'm the Executive Director of the Lighthouse Social Enterprise, a community organization working with and led by the young key populations, in particular MSM, trans, and LGBTIQ community in Vietnam. I'm very happy to joining the section today and talk about the impact of Syndemic to the Chemsex community based on the community perspectives. I want to walk you through to the languages, different languages are using by the communities in Vietnam. So in Vietnam, we don't call a Chemsex, but we call hyphen. And it's very particular among the community when they find the sex partner or they're looking for the member from the community. And you also can see there are also very different words that people are using to mention about the hyphen or chemsex in Vietnam. There are no particular data or specific data on the number of the people who using the people who engage in chemsex or using ATS among the MSM community in Vietnam. However, we also summarize some data from a different study in different country in Asia Pacific region on the prevalence of the chemsex among gay, bisexual men who have sex with men. So in Thailand, one study from 2013, it showed that there are 18% of the MSM who use drugs for sexual pleasure. And in Vietnam, one study in 2016 is indicated that there are about 15% of MSM who use the methamphetamine during sex, and it is about 10% in Singapore and 7% in Malaysia about the MSM who use methamphetamines and also engage in chemsex. There are also very different types of drugs in the chemsex among the community. Very common amphetamine type stimulants, and especially in particular methamphetamines are very popular among the community. They call meth, crystal meth, ice, very different the words to mention about methamphetamines. They also use ecstasies and methadone during the chemsex sections. They also use it in combined with the other drugs and inhibitors such as like ketamine or GHB, GBL. A lot of people using with poppers and Viagra. And there are a very large number of people who use methamphetamine with alcohol during chemsex sections. So from our study, we also trying to answer the question why MSM like to use ATS. There are very different reasons that community tend to use ATS more than before. The first is a lot of people faced with the depressions, isolation from the societies. Also, a lot of young MSM, they're very curious about the feeling engaging chemsex and using drugs and ATS. Some people face with the, some life milestone, such as breaking up with their boyfriends or be separate from the family as well. So they trying to find some new experiences in life. So drug is seen to be a good solution for them to improve that situation. In 2019, we also conducted one particular chemsex study in Vietnam with more than 300 chemsex users participate in this study. And we also answered the question, the reason why people engage in chemsex. And plenty of them engage in chemsex because they want to increase the pleasure during sex. A number of them also, feel more confidence to perform the new sex behavior, such as like group sex or BDSM or the other sex behavior as well. And a lot of the young people, they are very curious about the using drugs and what is the feeling about that. So they trying to use and then they be addicted with the drug use. So the question is how Chemsex becomes, a problem. Actually, it's not a problem, but it's increased some risks among the community. And the first we have to talk about the HIV. If you can look into the red line in the chart, you can see from 2011 in Vietnam, the HIV prevalence among the MSM is only almost 3%. However, in 2020, it's increased to more than 13% among the MSM community. And from the newest report of the government, the MSM community also contributes significantly into the HIV epidemics in Vietnam. And from 2010 to 2020, it's also changed a lot in terms of HIV transmissions among the key population and also among the MSM. And it's also contributed by the MSM community. So there are less transmission of HIV through the blood, but it's increased significance through the sexual behavior among the key population. Another study is also so very important, data among the community. The MSM community at the age of 16 to 24, they have the highest increase of the HIV prevalence from 2017 to 2019, according to the MSM cohort study from Hanoi Medical University. And in this table, you also can see the young MSM from the age of 16 to 24, they have the highest HIV incidence compared with the other age among the MSM community. And after a year, without the PrEP and the other intervention, there are about 7 HIV infected cases within 100 MSM people. I want to talk about another disease and epidemic, that is the STI. So STI also extremely high prevalence among the MSM community, according to the cohort study. So there are more than 40% of them have at least one STI, and 60% of them have anal intercourse without condoms in the last 6 months. The HIV prevalence is about 11%, but the highest is chlamydia and syphilis. It is very popular among the community at the moment. And look into the data of healthcare services experiences. There are very few people, few Chemsex users, they have been used PrEP before, and there are also very small amount of them have been tested for STI or hepatitis B and C. We also trying to understand why the community are not really, seeking and using services. And we found that the first reason is about stigma and discrimination in healthcare setting. So from this table, you can see there are a number of the Chemsex users, they've been charged by the health provider because they engage in Chemsex. A lot of people also be lecturers and rejected by the healthcare provider because they have the Chemsex and high fun behavior. We also look into the broader pictures to see different levels of the community, different level of barrier that community are facing. So in terms of the personal level, the community are lack a lot of knowledge in terms of the drugs and harm reductions. They also self-stigma themselves. It leads them to, poor access to the services and not retained in the PrEP or ARV treatment program. They also face with substance dependency and also a lot of mental health problems. In terms of the community, there are still a very heavy domestic stigma among the MSM community toward the people who engage in Chemsex and power sexual relationships among the community as well. In terms of the services, there are a lot of needed services are lacking. The existing services is providing the inappropriate time schedule for the community, so they cannot come to the services to seeking help. There are also still a lot of stigma from the healthcare provider. In terms of structural levels, stigma towards substance user, MSM, and using drugs in Vietnam is still criminalized. So this whole is a very large barrier for the community to access to the services. So we also discussed a lot with the Chemsex community in Vietnam, and we found there are some effective and potential intervention that we can apply. The first, always listen to the community. We have to know what exactly happens among the community, what is the new trend, what is the new cultures of the community, and how we can communicate with them appropriately. Increase the social media and internet-based initiatives to raise awareness on the drugs and harm reductions, also HIV and AIDS services. The third point is increase some e and mobile health services, such as like online counseling, provide the remote and mobile and online services, medical examination, home deliveries, commodity and services. We can also apply the multi-month dispensings of ARV of the PrEP and OSD, and they can also take OSD home to home. Continue service provision on site in the clinic and the community facilities, but we have to expand the working hours and creating the safe spaces and friendlier spaces for the community where they feel they belong to and they feel comfortable to talk to the health provider. Develop the interprovincial peer support groups, also very important, especially in the COVID situation, that we can provide the timely support to the community in need. And promote the in-country friendly service map to the community, not only HIV, but also the harm reduction, the mental health services, and also the other social services as well. And the last point, strengthen the community connection activities, especially among the Chemsex community, is super important. So at the Lighthouse, we also implement some pilot interventions to provide the services to Chemsex community. So we maximize and optimize the social media functions to deliver the awareness and knowledge to the community. We also deliver services through the Facebook and guided apps, such as like HIV testing, HIV self-test kit, provide the online counseling for them. We also create an application on smartphone where people can very easy to find the health facility near them by the service map in here. They also can look into the detailed information about the services that the facility provide, and also provide some feedback to the health facility and services that they can improve their service. We also apply the home delivery services and online codes. As you can see on the screen, we expand the workings on the online guided app, provide the counseling in there, and mail some harm reduction commodity to our client home. And last slide, we still maintain the services at our Lighthouse clinic. We provide the friendly services in here, and our doctors and nurses be trained to provide the proper communication to the Chemsex and MSM and TZ community. And thank you very much. That is my last slide. I hope you enjoyed the section, and we'll see you again in the panel discussion.